Diaz. If you suspect disseminated gonococcal infection, what should you do? Do a nucleic acid amplification test of the urogenital specimen. How do you treat Neisseria? Treat Neisseria with single dose ceftriaxone and azithromycin. If some patient is emailing you all times and strange things, what do you need to discuss with them? You need to discuss with them the appropriate use of email, right? What medication is like top of, your differential for causing thyroid dysfunction? Amiodarone. So with that, you want to check their TSH. If your patient is having menopausal symptoms and is older than 45 years old, what do you need? A biopsy, most likely an endometrial biopsy. How do you diagnose hypercalcemia? Right, first check their TSH. True or false? Malignancy can cause hypercalcemia. It's true, so you want to do a workup for cancer. If you have a patient recently diagnosed with systemic sclerosis, what is a good baseline test to get? Pulmonary function test. If you have a baby with a clavicular fracture, what do you need to do? Not really worry about it, right? Because neonatal clavicular fractures typically heals on its own. What are risk factors for pediatric dental caries? Observation, night feeding, decreased side effects, and fluoride. If you have a girl that doesn't have pubic hair, what you need to rule out? She's a teenager. Rule out androgen insensitivity syndrome. If a patient needs vaccines, a bunch of them, what should you do? Administer all the vaccines, right? If a patient is iron deficiency anemia suspected in them, what do you expect the MCV to be? Less than 80, right? If a person trips and falls forward and lands on an outstretched hand, what sort of injury are they most likely going to present with? A Fouche injury, right? If a kid or adult shows up to your clinic with pain, erythema, edema, and purulent discharge in granulation tissue, what do you need to check their ear for? Malignant otitis externa. If you have an old patient who has some medical issues, and they're most likely not going to survive, and they don't want to get crazy surgery or radiation or chemo, what should you do? Allow the patient to go home and arrange for palliative home care services. If you have a patient that says they have headaches, what should you recommend as first line sort of management? Recommend a headache diary. If you have a patient that has a headache behind one eye, what is the top of the differential? A cluster headache. How do you treat cluster headaches? With verapamil. If it is a very bad form of cluster headache and they're in the emergency room, how do you treat? Oxygen inhalation via a face mask. What causes heparin-induced thrombocytopenia? Antibodies directed against heparin platelet factor 4 complexes, right? For HIT syndrome, what do you need to do? Well, first off, you need to discontinue the heparin and start IV direct thrombin inhibitor. It is recommended to avoid all heparin products in patients with histories of heparin-induced thrombocytopenia. Right. For breast implants associated with capsular contracture, can that be frustrating? Yeah, definitely can be. Is there any evidence that silicone implants are harmful to breastfeeding? Nope. So if a mother with, or whoever with tits wants to breastfeed their kid and they have implants, by all means, go for it. Do patients with silicone implants have breastfeeding risks? Nope. Do patients with breast implants get regular mammograms? Yep, continue with the regular mammograms. How do you treat a nursemaid elbow? Right, try reduction and hyperpronation. Reduction and hyperpronation. Laser tattoo removal can cause what? Scars and discoloration. If a patient does not respond to treatment for osteoporosis, what should you do? You should search for a secondary cause. A radioisotope bone scan to detect osteoblastic bone metastases is sometimes used. True or false? Yep, that's true. Radioisotope bone scans can be used to detect osteoblastic bone metastases. If you have someone with a concern for alcoholism, what is the best question that you can ask them, even better than the cage mnemonic? How many times in the past year have you had 5 or more drinks in a day? If you have a patient that probably should be on a statin, what should you give them? Statin, right? Statins come up a lot, and just give the statin unless there's an like obvious contraindication, right? What is one of the best lifestyle managements for peripheral artery disease? Exercise treatment. How do you treat cryptococcal meningitis? There's 2 things. Starts with an A and an F. Amphotericin B and flucytosine. To help treat meningitis symptoms, what sort of procedure can an anesthesiologist most likely do? Perform serial lumbar punctures, right? Perform serial lumbar punctures. For cryptococcal meningitis, at 2 weeks, what do you want to do if they're already on treatment? Right. So you can stop the amphotericin B and flucytosine. Then for the remainder of the year, you want to give them fluconazole. For a ovarian torsion concern in the emergency room, what is one of the main imaging modalities that you want to use? A pelvic ultrasound, right? If a kid comes into your pediatric clinic and they're found to have a UTI, what is one of the first imaging modalities that you should do? A renal ultrasound, right? Definitely. All right. You feel me?